Welcome back to Primetime News, and again, a special welcome if you're watching on our One Spot Media platform. More details this evening about the country's COVID-19 vaccine distribution plan. Health officials say they will open vaccination centers across the island, which will initially vaccinate over 3,000 people per day. But the aim, they argue, is to get close to 20,000 people vaccinated per day as the weeks go by. Vashon Brown has more.
The first doses of COVID-19 vaccines should arrive in the island this week, but there have been questions about the plan for the rollout of vaccines when they get here. Permanent Secretary in the Ministry of Health, Dunson Bryan, says phase 1 of the rollout will see government officials, healthcare workers, the elderly and others receiving the vaccine. That phase should begin in March and end in June. Public health officials have already started to reach out to people in phase 1. The ministry will use an appointment system.
Now, if you wish to get an appointment, you must start the appointment process 5 days before you want your actual appointment. And when you ask for your appointment, you have to provide certain information: your age, date of birth, your area of work, comorbidity, your allergies, your address, the venue that you wish to be vaccinated at, your telephone number and email. Basic information that will guide us.
Mr. Bryan says people can make the application for appointment in different ways. Firstly, through a call center which will be operated by the Ministry of Health. The Parish Health Department will also take calls and allow people to make an appointment. Appointments can also be made through the regional health authorities or the Ministry of Health websites. The ministry says a daily vaccination schedule will also be prepared and the people will be notified of their vaccination date, among other things. At the vaccination center, there will be a 5-stage process: registration, counseling, vaccine administration, observation and documentation. That process can take a minimum of 35 minutes to a maximum of 52 minutes.
The difference lies in stage 4. For those persons who have no history of allergic response, they will only be observed for 15 minutes. However, for those persons who have histories of allergic response, the recommendation is that they be observed for 30 minutes.
There will be 56 vaccination centers in the initial phase. Each will have at least 2 people administering vaccines.
Our estimation, based on our time and motion calculation, is that each vaccinator can do 6 vaccinations within an hour, and the vaccination centers will operate for 5 hours during the day. So each vaccinator will produce 30 vaccinations per day. With that type of calculation, we recognize that we will be able to vaccinate at level 1 3,720 persons per day.
By level 3, the ministry is aiming to set up at least 19 mega vaccination sites across the island, producing at least 19,000 vaccinations per day. Phase 2 will include public sector workers, healthcare workers, as well as transport sector workers. That phase starts in May. The third phase will seek to vaccinate the general population, and that should start in August. Meanwhile, Health Minister Dr. Christopher Tufton says he's confident about the vaccine supply arrangements.
From March through to May, the equivalent of 974,800 doses arriving in the country. And this is based on arrangements that we have put in place and arrangements that we are relatively comfortable with in terms of availability and the delivery schedule.
Vashon Brown, TVJ News.
In the meantime, the health minister is defending why politicians have been selected to be part of the first set of people to receive the COVID-19 vaccine.
I think it's important to recognize the role that government, and government in the widest sense, or upper house or lower house, the 3 arms of government, executive, legislature, and judiciary. As you know, the judges are a part of that process. That they are important to the normal functioning of the society. There are a lot of decisions that have to be made that they will have to make. They preside over that process of governance. And you wouldn't want to have a situation where they are so restricted by virtue of an outbreak that some of those decisions can't be taken, because then the entire population suffers from that. So I think it's only, it is appropriate.
Amid growing worry about regular healthcare suffering because of the critical number of COVID-19 cases at hospitals, the Ministry of Health is seeking to allay those fears. The concerns increased on the weekend after an asthmatic teenager, Jalisa McGowan, died while seeking treatment between two hospitals. The health officials addressed the matter during the ministry's COVID conversations this morning. Although overwhelmed by COVID cases in recent weeks, the health minister is seeking to reassure the public that treatment for other health issues are not being compromised by the great demand. But following 17-year-old Jalisa McGowan's death on the weekend, that reassurance was questioned during the health ministry's COVID conversations on Tuesday.
I don't think any hospital should turn away anyone who has an asthma attack. And so the issue now is to get the details of what actually transpired.
Jalisa, an asthmatic patient, spent almost an hour trying to get medical assistance at the University Hospital of the West Indies on Friday. Her parents say they were told to take her to another facility, but she died shortly after reaching a second hospital. Her mother believes the current resource strain and fears associated with COVID-19 contributed to her daughter's death. But health officials are refuting that. Chief Medical Officer Dr. Jacqueline Bisesa McKenzie says strict protocols are in place to handle asthma cases. She acknowledges that COVID has created new concerns as nebulization may cause the release of contaminated droplets into the air.
And so there has been a move away from using nebulizations towards using more of the metered dose inhalations as part of the management in the emergency room, which is pretty much using your inhalers and using spacers.
She says emergency rooms have been fitted with the equipment. However, for asthma patients who cannot tolerate the spacer inhaler, nebulization is still available.
So those protocols are pretty clear. And certainly at this point in time, they may need to be re-emphasized. We will be having discussions with our emergency departments. I will instruct our Director of Emergency Medical Services in the Ministry of Health to convene a meeting with our heads of departments, of our emergency departments, to look at this again.
That meeting should happen this week. In the meantime, the health minister says he will await the outcome of that meeting and the investigations.
If there's a need for the policy to be clear or clearer, as the CMO has said earlier, then that will have to be done also. But I would want to await the report on the incident and then from there be more specific in terms of what action ought to be taken.